Tori Bowman, and you're watching Underestimated, a show about breaking barriers for people with disabilities. Underestimated is brought to you by Coretree, a division of Spinal Cord Injury Ontario. On this episode of Underestimated, we're talking about aging with a disability and specifically bone health. I speak with Lee Zinkin McKee, a registered nurse with the South Georgian Bay Healthy Aging Program, about programs and supports that are available to support bone health for people with reduced mobility. Oda chats with Benjamin Kwateng about preserving bone density after a high-level spinal cord injury. And we visit Dr. Laura John Gregorio at the University of Waterloo's lab, where they do bone mineral density testing. Stay with us. Lee Zinkin McKee is a registered nurse with the Georgian Bay Family Health Team Healthy Aging Program and joins me today to talk about bone health. Welcome.
Thank you.
So to start, what is the Georgian Bay Family Health Team?
The Georgian Bay Family Health Team is a primary healthcare organization. We have over 50 physicians associated with our organization, and then a team of other healthcare professionals involved. So we have nurse practitioners, registered nurses, occupational therapists, social workers, mental health counselors, diabetes educators, and so we provide primary care programming supports to patients who have a physician that are rostered with the Georgian Bay Family Health Team.
And how does the Healthy Aging Service work?
So we are actually called the South Georgian Bay Healthy Aging Program because we're broader than the Family Health Team. It's a community collaboration between the Georgian Bay Family Health Team, the South Georgian Bay Ontario Health Team, and the North Simcoe Muskoka Specialized Geriatric Service, and that's a regional service. So we work together to support older adults living with frailty and their caregivers or significant others to live independently and safely at home.
And it's an interdisciplinary team, you mentioned. So how do all the different healthcare providers work together to support adults that are aging?
Great question. So what we have is on our team we have registered nurses, occupational therapist, and a physiotherapist. And everyone is skilled and trained in basic, what we call geriatric assessments or comprehensive geriatric assessments. So any one of the clinicians on the team can be involved in those assessments. And then the various team members bring in their area of expertise. So if we're supporting a patient that has a certain area of concern, then we can pull in that person that maybe has that additional level of expertise.
And what's involved in the assessment? Just briefly.
Certainly. We actually offer two levels of assessment. So the first one is what we call a general geriatric assessment. This is specifically for patients who have a physician rostered with the family health team. And this is often a more targeted assessment. So maybe a person comes in with a concern about their memory or about mobility. Then we do a very targeted assessment. But then our partnership with the Specialized Geriatric Service supports us in providing comprehensive assessments. So these are appointments that are around 2 hours long, and they assess multiple systems of the body and how a person is functioning from day to day. And then after that completed assessment, then we can look at possible causes of the challenges the person's having, perhaps treatment strategies or support strategies. Then we provide health teaching around that and can make referrals to specialist or community resources as we need to.
And what specific programs and supports are available to support bone health, particularly for people with reduced mobility?
So again, it starts with that assessment. Mm-hmm. So the first thing we're going to be doing is that assessment, determining how targeted or comprehensive it needs to be. So for instance, a person experiencing problems with mobility, we're going to start with looking at their musculoskeletal system. So are they having trouble with balance? Is their gait off? Are they having trouble with strength? some of those kind of things. Then we're going to be looking at things like vision and hearing, because that all has an effect on people's balance and mobility. We're going to be looking at things like footwear. Is the person aware of proper footwear to be doing? Talking about their environment. So what possible changes do they need to make in their environment to help them with their mobility, or most importantly, avoid a fall. Then we're also going to be doing health teaching. So again, going back to mobility, we would be talking about things like physical activity, nutrition, doing a review of medications and talking about medications that might be impacting. Again, looking at the environment and talking about falls prevention and strategies to prevent someone falling and possibly getting a fracture.
This is kind of an obvious question, but what's the connection, or what's the importance of falls prevention and bone health for older adults?
Excellent question. So very often, a person, for instance, if they're starting to, or they're developing osteoporosis or brittle bones, there's not necessarily any symptoms that show up, signs or symptoms. So the person may not be diagnosed with it until they actually have had a fall. And once a person has a fall and a fracture, you have complications that can develop. There's a recovery period. It increases a person's vulnerability to another fall. So it's important that we do things that enhance our bone health and prevent a fall from happening.
If people are concerned about their bone health, what do you suggest?
So the three key messages I would say are physical activity, proper nutrition, and falls prevention. And if you like, I can go into a little bit more detail. So in terms of physical activity, the recommendations are 150 minutes of a moderate level exercise per week. And by moderate, we mean enough to get your heartbeat going, your heart rate raised, so you can talk through the activity, but you can't necessarily sing through the activity. Those minutes can be broken up into 10 minutes segments. So a person maybe can do some 30-minute sessions, but if they're not able to do that, if their mobility is decreased as such as that's too difficult, even doing it in 10-minute increments is equally valuable. We also talk about the importance of strength and balance exercises, and we recommend those 2 times a week, and that's to help with strengthening and balancing exercises. And what the evidence is showing, especially if people have reduced mobility, even a small amount of activity shows benefits. So, do what you can within your capabilities, that's of benefit. The second message is proper nutrition, and our recommendations follow the Canada's food guide, so eating from all the 4 food groups. When a person is aging, and in terms of bone health, what's particularly important is adequate amounts of vitamin C, vitamin D, and protein, and getting those through food. So that's really important. And the last is, again, talking about falls prevention. So what strategies can you do to prevent falls from happening? First and foremost, looking at your environment. So perhaps decluttering your house. Is lighting adequate in the house? Is there furniture in the way? So really looking critically at your environment. Is there good sticky runners or good footing going up and down stairs? Do you need rails? The other thing would be looking at footwear. So, having footwear with good soles on it, fit your feet firmly, and having good footwear for both inside and outside. Sometimes we have good footwear outside, but put on slippers inside that aren't so good.
Yeah, I shouldn't call him out, but I've talked with my dad about that. Okay, thank you, Lee. How can people learn more about the Georgian Bay Healthy Aging Program?
So they can go to our website, gbfht.ca. There's also the specialized geriatric services I mentioned, nsmsgs.ca, and if I could mention 2 other websites, and that's for really detailed information about physical activity, healthy eating, and falls prevention, is Osteoporosis Canada or the Arthritis Society are both excellent sources.
Wonderful. Thank you very much. Thanks for joining us.
Thank you.
While sitting in a wheelchair, bone density weakens. Joining us on video conference today to talk about strategies to maintain bone health is Benjamin Kwarteng. Thanks for joining me today, Benjamin. How are you doing?
I'm doing well. Yourself?
I'm doing pretty good. Yeah, I wanted to get into it to ask you. After a spinal cord injury, there's a lot to consider, as you know. When did you become aware of when you have to take care of your bone health and that it's even a thing?
For me, I think it was years into my disability. Let's just say after I got injured at the age of 22 and leaving the hospital and going through rehab and eventually trying to find a place to live, my bone density was not something that I thought of. You can imagine going through all the ups and downs and trying to manage with your care and finding out exactly where to live, the state of your condition. It took a while for me to even understand what my bone density was because I didn't even know, let's say 4 years after my injury, I had a doctor's appointment and the doctor asked me, hey, when was the last time I did my bone density scan? I told him I've never even done anything like that. And he told me, okay, I have to keep an eye on it simply because with someone that's living with a spinal cord injury, even the level that I am as a C4 complete, leaving me paralyzed from my neck down, I don't do any activities that will allow me to put pressure on my bones to keep a good, healthy bone strength. So when I did a bone density scan, he told me that, okay, I need to really keep an eye on this because my bone density mass is very low. And going forward, I have to make sure that I don't get it as low as possible simply because I could be, I might get osteoporosis. So it's important for me to increase some of the things that I'm doing that I'll be going forward, like increasing my calcium intakes and doing additional things when it comes down to having a healthy bone.
Yeah, that leads me to my next question. After you found out, however, you said it took you a few years. After you found out, what are some of the changes you made that had an impact for you?
Well, for my doctor, like I said, he asked me to increase my intakes when it comes down to eating more healthier. Basically adding a little bit more, as much as cheese as possible. Also drinking as much milk as possible and try to be more active, doing exercising here and there. He actually increased my dose on my calcium so that I can have a better bone health. But we decided to kind of monitor it for about a year to see how my bone mass, if it increased or not.
Do you have any equipment to help you with your bone health? Do you have a standing frame?
Well, I have a standing frame wheelchair, but before I even got my standing frame wheelchair, after 1 year of just monitoring my bone density mass, my doctor said it didn't improve in any kind of way, but it remains as it is, but I need to find a way to kind of increase my bone density mass. So he suggested that I started doing this 1 year, every 6 months injection. It's called polio injection, and every 6 months, when I do it, I go do my bone density scan to see how it's going to affect me going forward and if my bone density mass has increased it. But when we did it, it didn't show any effect. But from there on, I was eligible to get a new wheelchair. And unfortunately, a lot of people do not have the means to afford a wheelchair that stands up. And for me, to be honest, at that time, that was the best way to go, regardless how much it costs. I was able to purchase a wheelchair that allows me to stand up. So with this, it helps you with many functions when you come down with disability. Because you're not moving a lot, your bowel bladder doesn't function the same. And for me, because I was able to stand up on my wheelchair at least three to four times a week, it helped me a lot strengthen my bones. It put a lot of pressure on my hip bones, my knees, all my joints. So from there on, after doing this for a couple of years, I saw a dramatic changes on my bone density mass as it increased to get a little bit more healthier.
And were you able to get right into 3 to 4 days a week, or is it something that you had to build up to?
It's something that I had to build up to. So you can imagine, if you think about anybody that's just sleeping for like, let's say, throughout the whole day, as soon as you get up and you step on the floor, remember I was able before, as soon as you step on the floor, you start to get dizzy. And that's a natural reaction because we haven't put in any pressure or we haven't stood up in a while. So the first few times that I do it, I'll go up for at least like 5-10 minutes. Then I start to feel dizzy to the point that I might feel like I'm about to pass out. So then I have to go back down for at least 10 more minutes. So gradually, I just keep on doing it little by little until I'm able to stand up for a few hours at a time throughout the day.
So it's something you have to build up to, and eventually you can reap the benefits.
Yes, that's definitely.
It seems like that's what gave you the biggest, what has had the biggest difference for you.
Mm-hmm. Yes, it has. It has, because without this opportunity that I have, it would have. I don't know exactly where my bone density mass would have been. So by me standing up as often as possible, but it's not just doing your wheelchair standing and stuff that increase your bone density mass. It comes down to eating healthy, keeping an eye on some of the things that your activities that you're doing. And I think for the chair, it was just an added additional help for me. If
there's any advice you'd like to give someone who's wanting to manage their bone health, what would you tell them?
I think for me, what has helped me is in so much ways is for me to actually keep an eye on my health, monitoring my intake. That's very important. And if you're able to do any activities that will allow you to put more strength on your bones, I suggest it's highly that you do it. For me, because I cannot work out or do any standing on my own, that's where my bone density got a little bit low. And if you think about it, once you're in a wheelchair, 99% of the time you're either sitting down or you're lying down in bed. Most of the time, even when you're moving around, there's somebody that's moving around for you. So I think for me, the only advice I can give to anybody that is trying to increase their bone health or even aging with spinal cord injury, you always have to keep our eye on your health simply because things change. As we age, we have to do things differently. If you have to transfer to bed on your own, sometimes you might need assistance as you age. Your bowel bladder might not function the same, so you might have to do additional, maybe some changes in your bowel bladder functions. And especially when it comes down to your bone density, your bone does get weaker as you age. But trying to find a way to increase your bone density mass by either having more calcium in your diet, increasing your calcium pills, your vitamins and stuff. So,
right, as you know, Benjamin, I have a spinal cord injury, and it took me a few years to realize how important bone health is. So thank you so much for sharing your story with us. Thank you for being here, Benjamin.
No problem. You're welcome.
Bone health and preventing fractures is important for everyone, especially people living with spinal cord injury. Today I'm at the Bone and Body Composition Lab at the University of Waterloo, where I'll be learning about bone density measurement and preventing fractures relating to osteoporosis.
Osteoporosis is a bone disease that is associated with low bone strength and an increased risk of fracture. There are a number of strategies that are used to prevent fractures. The first thing is to assess your risk. So we want to assess risk factors for bone loss or for fractures. And then if someone is thought to have some risk factors, they can be sent for a bone mineral density scan to assess their bone strength. The next is to recommend medication for people who are at increased risk of fractures. And there's a number of different types of medications that people can try. And also to ensure that they're getting adequate calcium intake and adequate vitamin D. And finally, we also want to do exercise and fall prevention. So the number one cause of hospitalization in older adults is falls, and many falls cause fractures of the hip, of the spine, of the wrist. And so if we can prevent falls, we can prevent fractures. And one of the best ways to do that is with exercise. So exercise has been shown to prevent falls in older adults. Some types of exercise may also increase bone mineral density. So it can prevent fractures both by preventing falls and potentially having an impact on bone strength. With a spinal cord injury, there are additional risk factors for fractures that are slightly different than in people who do not have a spinal cord injury. So for example, having a motor complete injury, or having tetraplegia or quadriplegia, or being a woman who's over 50 and has been at least 10 years post-injury. Those are some examples of risk factors that are specific to people with spinal cord injury. There's also certain medications that are used more commonly in spinal cord injury that can increase the risk of fracture. So it's really important to talk to your doctor about your risk factors. And also really important that we do some research to get the knowledge around those risk factors out there. With fractures, if you're admitted to hospital, then there's the risks associated with being in hospital for a long period of time, like being sedentary or being immobilized, so then you can have muscle atrophy. There's the risk of infection. There's the risk of delirium for some older adults as well, and this can then cause functional deterioration, and in some cases people can no longer live at home independently. So after hip fracture, about 25% can no longer go back home after having hip fracture because they can no longer live independently. To prevent fractures, we can do a number of things. So one is talking to your doctor about your risks and seeing if medication would be right for you, making sure you're getting adequate calcium and vitamin D, and then making sure that you prevent falls or prevent the activities that could cause fractures. So for example, if you are doing transfers, making sure you're transferring in a way that your body and your legs are facing the same way and you're not twisting your legs. If you have a person helping you transfer, making sure that they know how to transfer you safely, making sure that when you go through doorways that you're checking to make sure that your foot or other limbs are not going to get caught. And then if you are ambulatory, if you're walking, to either use a assistive device if you need one, or work on your balance to make sure that you're stable when you're walking to prevent falls. There are a number of exercises that can be used to challenge balance, to improve balance. And even if you are not a person who walks, working on balance and sitting so that you're less likely to fall over or fall over from your chair, or using assistive devices like a seatbelt to prevent you from falling. Bone mineral density is measured with an X-ray machine called dual energy X-ray absorptiometry. It's also referred to as DEXA, DXA. You lie on a table and have an X-ray, and they will sometimes X-ray your spine, they can X-ray your hip, and in people with spinal cord injury, there's a specialized scan where they X-ray around your knee. And the reason for that is because the bones around the knee, so the femur and the tibia, are the most common location of fracture in people with spinal cord injury. The way that screening for bone density or risk factors is done in people without spinal cord injury is using an algorithm called FRAX or another algorithm called Geriatric. And those are designed for people over the age of 40 or over the age of 50. And so people who are younger with a spinal cord injury may still need to have their risk assessed because of their spinal cord injury. So maybe making a physician aware that they may still be at risk even though they're at a younger age. The other thing is the accessibility of DEXA screening. So you need to make sure that you go to a bone density lab that has a lift if you cannot transfer onto the scanner. Many people don't really think of fractures as a significant cause of death or disability. So people think, well, they have a fracture and then they had it repaired and then they go home and they recover. But many people don't realize that fractures, 20 to 30% of people who have a hip fracture will die as a result of the secondary complications associated with that hip fracture. People who have spine fractures are at increased risk of breathing problems and digestive problems and chronic pain, and even wrist fractures can compromise function of your hand. So it's really important to prevent fractures. A common myth in people with spinal cord injury is that they may not need to think about fractures because they're young, but bone loss occurs very rapidly after spinal cord injury, even in young people, placing them at increased risk of fracture. In people who don't have spinal cord injury, and in people who do have spinal cord injury, we need research to understand how to put exercise interventions into practice in the community. So how do we make effective exercise programs available to people and accessible to people? A huge barrier is funding. So exercise can have a number of health benefits, but unfortunately we don't fund exercise services. And the exercise services that are available through community programs are often delivered by people who maybe don't have the skills to tailor exercise for people with disability or people who have falls or who have osteoporosis, or maybe they're uncomfortable in sort of tailoring the exercise to be aligned with the types of exercise that have been shown to be effective. So for example, when we look at the falls literature, the types of exercise that are most effective are balance and functional training, and there's very specific types of exercise programs, but maybe people who are delivering the exercise programs aren't aware of that research and maybe aren't delivering the same types of exercise. So our research looks at how to prevent fractures, either through better risk assessment or through interventions like exercise. And we also work on how do we actually get the research into practice. So doing research on how to do that better. I would say in the research, we need to do, in spinal cord injury, we need to do research to better understand how to identify who is at risk, and then also research to figure out how to help clinicians identify who's at risk and also understand what treatments are most effective. Our research lab, the Bone Health and Exercise Science Lab, has a Facebook page. We also have a YouTube channel where we share brief educational videos, and you can find me on Twitter.
Thanks for watching this episode of Underestimated. Thank you to our guests for sharing their experience and expertise. To learn more about the services and resources Courtry and Spinal Cord Injury Ontario provide, visit our websites. I'm Tori Bowman on behalf of Oda and all our guests. Thanks, and see you next time.